You're live.
You ready?
We live? Hey guys, it's Dr. Emer, and we're here on the weekend. You know, we do one Saturday a month, and I'm super excited to be back after COVID in the office. Less patients, but still enjoying the artistry and the fun of doing all of our injections. And today we're going to use Allergan products. So we're going to do the basic, what I call facial slimming and contouring of the face. The cheekbones, the lips, and the central face, like the eyes and nose, give you all the essential components of beauty. So in my patient here who's young, already very beautiful, but she has a high stress job, works really hard, she starts to notice a little sagging in the midface, under eyes becoming a little dark and hollow, and loss of her lateral cheek and temple. So what we want to do is we want to improve, we want to lift this area. This is called an OG curve, where we improve volume in the temple, the lateral cheek, and then this little break in the middle part of the cheek to lift it up so you don't have as much under eye hollowing. And then typically if we were to do more, we would extend the chin, we would bring out the jawline, and then we would just start tightening the skin with energy-based treatments. Now on her, we want to give her more slimming, so we're going to use a little BOTOX to slim the masseter. This is very popular in Asia and Middle East because people have usually rounder faces in that ethnicity or in that area of the world. She's already contoured and she has some TMJ, so we're going to use BOTOX to just help the muscle here. We'll slim everything down. So that's what I call female facial sculpting and facial slimming. Let's start. So we're going to use a little bit of Juvederm, and I like this product because in the cheek area especially, if we're focusing on this breaking point, we can get a lot of sort of volume that builds up. This product will hold a little bit of water and give a lot of lift. And so look, you can even see in that, just that small amount, that little aliquot, look what happens. Right there, take a look even in the difference from this area here to right here. That small amount, that breaking point, improves the eye, the overall look of the cheek, and highlights her beautiful lateral cheeks, which is what we want. Just small amounts, because Juvederm will hold a little water, and she says she swells up like a blowfish, so we don't want that. But we do want her to have lifting, and so we're going to use the filler in this angle. You could draw lines or whatever you want, but in general, it's based on artistry and skill.
Dr. Emer, you're my inspiration. I'm a student from the Philippines.
Oh my God, thank you for following. We love you. You know, it's all about great results, making people happy. I'm going in different layers here on the bone to work to give her just a nice contour and a nice lift. All the way back on the bone, using Juvederm, because on her face we want to get a nice lift, and everybody knows Allergan products give amazing results. So now we're going to go to the other side.
They're saying you can already see the differences in
Talk
the
about the
side.
difference
Yeah,
between one
show
side and the
them.
other.
So let's take a look. So we just did what I call mid-face and lateral volumization. But look at her eyes even already. Obviously ignore those beautiful lashes because that's not what we're focused on right now. But take a look, that breaking point where she had that lost volume, look at the under eye, it's improved already. And now she has more mid-face and lateral cheek position. So if we turn her head here, look at that contour. Once this all settles in, this is lifted, the folds improved, and the under eye is improved. So we want to do that same thing here. Again, following that breaking point, seeing where her volume and where her early sort of lost volume is. I know I don't have Tourette's, I'm not twitching, I'm just helping it so she doesn't have as much pain. And again, I don't like to use Juvederm directly in the eye because it holds a lot of water. You don't want the puffy eye look, but unless it's Volbella, which is a different form of Juvederm product. But on the bone here for the mid-face, this is such a great product choice.
Hello from Chile.
Hey Chile, how are you? Thank you for following. Come visit us in LA. And look, again, following that lateral cheek all the way back on the bone. She's doing amazing. And again, I'm going to move a little bit more superiorly different plane just to get it all to blend now. Building up the different levels of the cheek and the bone. Because I want her just to pop. I want her features to pop. And this is just going to make her feel so much brighter because she's got a busy job. And that job requires a lot. And when you're super slim and you're stressed and you work a lot, you lose a lot of volume in your face. And so fillers, yep. Let's go.
Doctor, if you have acne, can you do filler?
Oh yeah, if you have acne, you can. I wouldn't inject directly into the acne itself. Oh, that's really good. So guys, take a look already. Look at the difference. That's a big difference, even with one syringe. And normally I would probably go a little bit more, but this is a good starting point because remember I said, with Juvederm it builds. You can see now she's slimmer, she has more of an angle. So what I'm gonna do now is I'm gonna use a little bit of BOTOX to help her TMJ and also give her some tightening along her jawline. So perfect, bite down. So when she bites, you can feel the muscle, relax a second, very strong. We're gonna go right into that muscle and inject a little bit of the BOTOX. And this is an off-label use. Bite down, relax. BOTOX itself, perfect. Bite down, great, good. And it's really not that painful. In Korea, they do a much more significant amount of the BOTOX, but that would make her too slim. Turn a little this way, bite down again. So you can tell this side she bites a little bit more because this muscle's a little stronger. And we'll take a look at this in about 2 to 3 weeks. Bite down, perfect, you see. Relax, good.
Sending love all the way from Kuwait.
Love you guys, love my Kuwaitis. I need you guys to come here, I need to go there. And that will work to now slim this down. We'll use other treatments long term because she's just very slim. We need to tighten the skin to do things like Morpheus treatments, Ultherapy and Thermage. But in general, our goal here was to give her this contour and give her the slimming. So let's show her that, at least for right now. Where is our little mirror?
You want to do the Emer reveal?
Her cheeks. Oh yeah, do an Emer reveal first. Let's do that. Show her her cheek. Look at your cheekbone. Take it in your hand. Take it in your hand.
Oh, wow.
What do you think?
Oh my goodness. Look at that contour.
I love it, you guys, because the cheek area obviously gets a little swollen, but the cheek area is the central part of facial beauty. And one of the biggest things you guys know when you look at,
Oh, it looks amazing.
Let's take a look.
This is exactly what we wanted.
Exactly. We want to lift this. We want to get more contour using Juvederm. That's a great result. Now, let's take this back. Let's show you, hold on this. What do you think in the regular mirror? Because it's always a little different
Wow.
in there.
This is exactly what I wanted. High cheekbone.
And now, yeah, and then we'll work later to give you a little bit more through here in the folds and the temple.
And see how it makes it look thinner here, so I don't even need to wear contour makeup now.
Exactly.
See?
It's perfect. So successful facial slimming. Stay tuned for a few weeks. She'll send up some selfies and a little video showing amazing results.
Thank you, Dr. Emer. So excited.
Bye, guys.